Yeah, good afternoon. Thank you, John. And I'd also like to thank Courtney for, she's the ILSI staff member who really supports this committee, and without her dedicated work, we'd really struggle to get all the great things we get done on the committee that I chair, because I'm the chair of the ILSI Bioactives Committee. So I'd just like to, maybe many of you aren't familiar with ILSI, so I'd like to just start by just making sure everybody knows who ILSI is before I get into just some of my initial comments to set off this series of discussions and put them in perspective. So ILSI is the International Life Sciences Institute. It's a global organization. There's a chapter here in Buenos Aires, and there's chapters throughout Latin America, and we're quite active in our North American chapter. And the goal of the organization is to really work on improving human and environmental health, safety, and well-being around the world. And what's unique about the organization is that it's a great way to bring multiple stakeholders together with academic, government scientists, and industry scientists to tackle important scientific questions. And it's a great place to get some really interesting work done. There are a number of committees in North America. You can see the ones that are active here, and the one that is sponsoring this particular symposium and workshop is the Bioactives that had been called the Flavonoids Committee, and we've recently renamed ourselves Bioactives to allow not only discussion about flavonoids but other bioactives such as lutein and other phytochemicals. These are the member companies that participate in the committee at this point in time. And John Erdman and Joanna Dwyer are two of our academic advisors that help us a great deal. So what do we do as a committee, and what's led us to really being interested in this workshop? We've been working on flavonoids for quite some time, trying to work our way through exploring what is the scientific basis or evidence that dietary flavonoids can promote human health. So we've done a number of workshops and evidence-based reviews over the years that have been published to try to begin to look at the science that would support health benefits of dietary flavonoids. We've also funded a number of epidemiological studies, and now we've moved forward to the idea to say how can you facilitate the idea of setting dietary guidance or some type of recommended intake recommendation for non-essential food components, or those foods that seem to promote positive health, and what is the framework and what is the basis that would allow health organizations or government organizations to actually take that action, and what is the scientific basis for supporting those actions. And that's some of the discussion that we hope to have today. One of the interesting things we've seen, and just to put it into historical perspective with flavonoids in this whole workshop, I went back and was looking at the history, and actually Albert St. Georgi, who discovered vitamin C, published 2 papers in Nature back in 1936. And in 1936 he actually coined flavonoids vitamin P, and started this whole idea that flavonoids from his work were actually important nutrients. And what he actually found is when he was trying to use vitamin C to solve scurvy and restore the health of blood vessel endothelium at the time, we didn't understand it the way we do today, but when he provided the vitamin C from citrus peels as opposed to pure vitamin C, he discovered that the capillary walls and the recovery from scurvy was enhanced to a great degree, and he proceeded to purify out a flavonoid fraction from the citrus peel and was able to show that was responsible for enhancing the recovery from scurvy by promoting blood vessel wall health. So we come back around now in this meeting, and what have we spent most of the time talking about in terms of at least a number of our key flavonoids is blood vessel wall health. So it seems we've come a full circle, but we know a lot more about the mechanisms and the reasons, and that brings us to this debate that Albert St. Georgi had. Originally he wanted to call it vitamin P, but he wasn't able to show that it was essential. Although he still believed that probably it was essential, but you couldn't really deplete people of it in diets. And his feeling was that the deficiency symptoms might take an extremely long time to manifest themselves. So in the end, the scientific community would never support the idea that these were truly essential components from our diet. As we've gone and done a number of the evidence-based reviews workshops and looked at the science, one of the things that become apparent to us is that there's a lot of heterogeneity across the studies. There's a lot of heterogeneity because things aren't defined and things haven't been commonly studied and had common terminology used. So it's extremely difficult when you're doing evidence-based reviews or meta-analysis to know what's the basis for which studies you should include, exclude, how do you compare them. And so we thought that's an area that's really important to discuss. And Mario is going to talk through some of the thinking that we've had as a committee on the importance of doing science in the right way. And then we're going to move on to really trying to get what is the path to intake recommendations. And one of the issues that we struggle with, I think, in this area is that traditionally, more and more, we only look at endpoints of cardiovascular disease risk or blood pressure or stroke or really disease risk reduction. And there's very few biomarkers that are validated that would support those things. So are there biomarkers of health and wellness that might also be considered to be ways of defining the fact that some of these non-essential food components actually promote health? And you might think of lutein as a nice example in that it's a nutrient in our food that accumulates in the eye, and it's pretty clear that it promotes eye health. Yet we aren't quite ready to say it's essential. But that's another example of a non-essential food component that has important health-promoting properties. And even if you look back at vitamin E, which is considered essential, it basically functions as an antioxidant. And when it's not there, membranes oxidize, then nerve function gets degraded because of membrane oxidation, and you get the side effects of that. But in a sense, it's behaving as an antioxidant. And if you look at most of the long-term intervention trials that have looked at whether vitamin E might reduce disease risk, most of them have failed. So I think we need to ask our questions, do we really need to do those sorts of studies to come up with either dietary guidance or intake recommendations for these things? And we hope to address that as part of this symposium and really say whether or not we should be looking at a paradigm that's about food-based and nutrient-based as opposed to drug-based. So with that, the session objectives is really to cover some of these factors, to say what are the recommendations and good guidelines for designing and implementing and reporting of studies on flavonoids or other non-nutritive components. What's the kind of evidence that we would need to support dietary guidance, and what are the possibilities there? What are the limitations of applying the current models that have been used in the DRI framework to set recommended intakes in the U.S. or in other countries, and what parts of that can be applied to these questions and which ones should we reconsider? And then how can we put all this together that might develop a path and a framework that might lead to recommended intake when we have robust science, because by having that framework, we'll know which science gaps to fill. And then we'll conclude with a panel discussion. And so with that, I'd like to invite Mario to come up and give us the first talk of this session.